We're streaming live here on BabyLiveAdvice. Thank you so much for joining us tonight. My name is Sigi Marmorstein. I'm the CEO and founder of BabyLiveAdvice. I'm a nurse practitioner and I work in emergency medicine and maternal child care for almost 30 years now. And joining today by Elaine and by Genevieve. I'll let you guys introduce yourself. Go ahead, Elaine.
My name is Elaine Kopinga. I'm a certified nurse midwife and women's health nurse practitioner. I've been working in women's health for over 10 years and specialize working in gynecology, pregnancy, postpartum, menopause, urogynecology. And I'm just really excited to be here tonight. So thank you, Sigi, for the opportunity to connect with all of the women out there today.
Oh, exciting. And Genevieve, why don't you say hi?
Hi, my name is Genevieve Thomas Colvin, and I'm a lactation consultant. I've been in practice for over 10 years. I currently work days at UCLA Health, where I cover our outpatient program, and I have been a previous regional breastfeeding liaison for the WIC program, Women, Infant, Children, which is a USDA-funded nutrition program that provides breastfeeding support to low-income families. And prior to that, I was a program manager at Breastfeed LA, where I helped to do policy and write healthcare policy for employed mothers. I've helped to change the laws in our state, the great state of California, which has some of the best legal protections for breastfeeding women. So I'm happy to be here. Thank you for having me.
Excellent. Thank you so much. Well, BabyLiveAdvice has been around for about 4 years, and we have mostly are doing maternal child care via live consultation over video. We have about 40 different providers. All of them are moms. All of them are providers, nurses, midwife, lactation consultants, mental health providers, nutritionists, and many other wonderful providers. So wonderful thing to have you here tonight. I want a quick shout out to our Mamathon this whole entire weekend, starting Friday, May 9th, all the way to Sunday, May 11th. We will have all of our services, all of our classes, all of our support group online are going to be free. And visit us at babyliveadvice.com or go to our Facebook at BabyLiveAdvice to get more about our products. So, Elaine, the first question will be for you.
Okay.
Many moms are really concerned these days about COVID and pregnancy.
Sure.
2 questions we are getting is, one is, should I even be pregnant right now? And the other one is, if I am pregnant already, what will you tell me about the risk of COVID for my pregnancy?
Those are great questions. One of the jokes that we have in OB right now is that all of the women that are getting pregnant in the middle of this COVID are clearly first-time moms, because they don't know how hard it is to be sleep deprived and tired. But the good news is, yes, it's okay to be pregnant right now. I know that it's a scary time. There's so much that we don't know about this virus and so much that we're learning. The good news is that some of the early research that's coming back is that pregnant women are not passing this virus onto the fetus. They're not passing it on to their babies. So that's one of the great things that we're seeing early on. So absolutely, this is a great time to be pregnant if you're home and nothing else to do. You can snuggle up with your partner and have some COVID babies. So and the good news is that there's providers that are here to help you to answer your questions as far as being pregnant. Obviously, we want women to be smart and to be safe. So we're really urging, just the basic, wash your hands, don't touch your face, social distance as much as you can, all of those precautions to protect yourself and to protect your baby and your fetus during this time. But there's no research that shows that, a woman gets pregnant and she's going to have a risk of preterm labor or miscarriage just because she may contract the virus. And what was the second question?
The second question is, if I'm already pregnant, what can you tell me about being pregnant what's my risk of being pregnant if there's a COVID around? Am I in a higher risk with COVID?
That's a great question. So, obviously, yes, anytime a woman is pregnant, we always consider her to be just automatically in a higher risk category. You're a little bit more immunosuppressed when you're pregnant. You're caring for two lives instead of one. So we do put pregnant women in a higher risk category, but it's not necessarily because pregnant women can pass it on to their fetus or because it can cause any harm to the baby. It's just we want you to take extra precautions. So again, if you're pregnant, definitely washing your hands, don't touch your face, don't be in an area, in a high risk area if you don't have to be and if you can avoid it. Many doctors' offices are doing more telemedicine visits, telehealth visits. At the hospital, we're really, thinking twice before we tell a woman to come in to be evaluated. We're taking the time to talk you through your concerns and your issues. So it's just having extra precautions, but there's no reason to have, an intense amount of fear or to be scared because you're pregnant during this time.
Okay, perfect. I'm looking at some more questions. And so one of the other questions, Genevieve, this is probably is for you, is if I had my baby already and they are, I just came and I just had my baby in the hospital, are they going to take them away? Should we be separated? And then if so, should I be breastfeeding my baby?
Well, if you're COVID negative, then of course you need to be breastfeeding your baby, and we would recommend that nothing changes. If you're COVID positive, then you're going to want to talk to your provider about your own risk factors. And then I would recommend that we breastfeed still, because what we know about the virus right now is that it's a coronavirus. It's going to be passed through respiratory droplets. And so you can protect your baby, your new baby, by wearing a mask and washing your hands and changing your clothes and protecting your baby just the same way you would if you had the flu. And we would still recommend if somebody was positive for the flu that they still breastfeed, because it's still best for the baby. In fact, the real risk here is not vertical transmission like Elaine was talking about, where you give it to the baby while you're pregnant, but horizontal transmission, coughing on your baby. So avoid coughing on your baby and continue to breastfeed. In some cases, if the mother was particularly sick, like very sick, so sick that she might need to be on a ventilator, then of course it makes sense that we would want to separate that mother and that baby. And we would still want to protect her milk supply, because assumably if she needed to go to a higher level of care, like in an ICU, then we would want to make sure she had a dedicated breast pump and that she was provided with all of the support to bring in a really strong milk supply, so that when she was able to be rejoined with her baby, she would be able to breastfeed just the same way we would in any other situation. And in some cases, we may want to do, if you're staying in a hospital, some in-room engineering is what we call it. So for example, when not in contact with the baby is safely swaddled in the bassinet behind a curtain, so that the mother can take the mask off 6 feet away, so she can have some time to be able to be unmasked and be able to take care of her own needs. So there's lots of things we can do to be able to help moms and babies to breastfeed during COVID-19. The World Health Organization does not recommend separation, and they have a beautiful, beautiful triage tree, like a tree on how to determine what would be best. I think it's an excellent resource, and I'm recommending it to a lot of our hospital personnel who are taking a look at these things. I think that the thing that's hard right now for most mothers is that the AAP has come out and said that they really believe that babies need to be separate, but it doesn't make a lot of sense. And I think the CDC's new guidance that came out as of April 4th is much clearer, that this is a shared decision, that nobody should be forcing your baby away from you, and that you need to be having a conversation with your providers about what your risk factors are and what the risk factors are for your baby before a decision about separating you from your baby is made. Does that help?
Yes, I'm sure that that's what people want to know, right?
Good. Yeah.
Yeah. Good. So, we telling everybody to ask questions. If you've seen us right now and you have any questions about anything, lactation, prenatal, postnatal care, anything baby, please, go ahead and text your question here, and we will definitely be willing to answer all of your questions tonight. I'm sure that there are many of them. So Elaine, one more question for you is, if I go to the hospital, should I have my baby in the hospital, or should I have my baby at home? And what are the risks for each one of those if I decide to do either one of them?
I think that's probably the #1 question that I've been getting as a midwife. And I think it's a very important question, and it's also a very important decision. Genevieve just talked about shared decision and informed consent. And I think that's the number one thing. Our jobs as clinicians and as providers is to give you the information. Obviously, as the mother, you and your family and your partner can make the decision that you feel is best for you. So while we know that obviously coming to the hospital, there's a risk of, contracting a virus or bacteria or not just COVID, there's many other things at hospitals that someone can pick up. And while they're there, we also have to look at the risk versus the benefit of having a baby in a hospital versus having a baby at home. So we know that there's certain concerns that we have with women having the baby at home, because if something were to go wrong, a hemorrhage, or maybe the woman's bleeding, or the baby's heart rate were to drop, we know that if you're in the hospital, the chances that we can take care of you faster there's just better chances that we can address those issues faster. Whereas if you're having the baby at home, it does take more time. You'd have to transfer you to the hospital, and when you're having a baby, time is of the essence. That being said, there is also a lot of evidence that shows a healthy woman with low or no risk factors in her pregnancy can have a healthy and wonderful birth at home. So my recommendation would be to have a conversation with your individual OB provider about your own and personal health risks, the risk for your baby, the risk for you throughout your pregnancy, so that you guys can have a really, really informed conversation. The fact, your risk factors are different from someone else's risk factors. So it's important to have that conversation with your provider and then to be able to make that decision from there.
Well, that's very important too, for sure. I have another question here about breastfeeding. Genevieve, is if any one of my family members have any kind of symptoms, what do I do when I bring them home? Do I keep this baby quarantined? Do I bring the baby home and put them in a room and never take them out? Or what do I do with this baby once they come home from the hospital?
Yeah, we should reduce the number of people that this baby is coming into contact with. And so one of the beautiful byproducts of what's happening right now is families actually are really getting to rest and recover from birth by not having a lot of visitors right now. So what I'm observing in the hospital is that families are becoming families in one of the most beautiful ways ever. So siblings, families, friends, a lot of people are unnecessary in those first weeks after a baby is born. And we really it's a great time that I would recommend that anybody who is not, I always tell our families, if you weren't there at the conception, you probably don't need to be there later. So let's let the people who were there at the conception of this baby take care of the baby. But this does pose a real hard question, because if you have a partner who is a first responder who has been exposed, what do you do in those situations? I would recommend that our families use their paid family leave, or they use their time off if they are first responders, and avoid coming into quarantining themselves for about 14 days before a mother goes into labor, so that afterwards they can be a real help to their partners. And then anybody with symptoms should stay away from the baby, because it's hard enough having a newborn baby. We don't need to add having to be readmitted to a hospital because they're very sick. So really we would avoid having anybody around the baby, in the same way we would say, at any other time. We don't recommend that parents go out a lot in the first month after their baby is born, because the baby is vulnerable. But mostly we don't recommend it because mom really needs to recover from the difficult process of getting a baby on the outside of her body. And so that really does require a lot of resting at home. And really, if people want to be helpful, they can go to the grocery store and drop off food on the doorstep. They can bring meals that are prepared. There's lots of ways that family can be helpful that doesn't involve actually coming in and exposing the family unnecessarily.
And also doing this, right? So using the internet and FaceTime and Zoom and other modalities to have babies not exposed as much to the environment.
Yep. That's a great way.
Yeah, that's a great way. Another question that we have in here is, should I go to my prenatal and postnatal appointments? Is that means that I'm going to be exposed to COVID? And then the second part of that question, which is pretty much the same thing, is, should I be taking my baby with me to my postpartum appointments, or should the baby not be seen by anybody?
Well, again, I think that one of the most important things that I think that I want to stress, and I know that we all want to stress, is that yes, COVID is out there, but it's still really, really important to care for your body and to care for your baby. So in the same way, if someone was having heart attack symptoms, or someone felt like they were having a stroke, we wouldn't want them to avoid those symptoms. We do want you to come in for your prenatal visits. And one of the beautiful things from this is that many doctors and midwives are really scaling back the number of patients that are coming into the office. We're distancing patients when they are waiting in the waiting room, or not even having patients in the waiting room. Many visits, sometimes even the initial pregnancy visit, can be done online. So, talk to your provider, make sure that they are taking measures to help social distance and to protect you. Wear a mask when you go. Many providers are wearing masks when you go in to see them. So yes, you definitely want to make sure that you're caring for your baby and caring for yourself during this time. If you have to go in to, take your newborn to see the pediatrician, again, these are all important visits. Talk to your pediatrician. Is this something that can be done online or as a telemedicine visit? Do we have to go in? And many providers are taking steps to help to protect you. Now, as far as do you need to take your baby to your postpartum visit, that's totally up to you. Most women, I'll be honest, many women don't, just because it's hard enough to get in and out of the door as with the mom with the baby. So many women don't take their babies to postpartum visits even before coronavirus. But obviously it depends on what resources you have at home. If there's someone to watch the baby for you, someone you trust, a safe place to leave your baby, then sure, give yourself 45 minutes to an hour by yourself and go see your provider. But if you're in a situation where you don't have a safe person to watch your baby or a safe place to leave your baby for an hour, then you're better off bringing your baby with you.
And don't not go to that 6-week visit. And it's really important that you definitely follow up for that 6-week visit. But with your baby, it's critical that your baby be seen 24 to 48 hours after discharge. If your baby is not gaining weight appropriately, if the baby isn't feeding well, if the baby is experiencing jaundice, it's really critical. So if your doctor recommends that you come back at 2 weeks after your baby is born, the pediatrician says that, or the family medicine doctor says that, it's because they want to make sure your baby's growing well. And there's a lot of little tricky things that can happen in the first month of life. So weight checks are very important to make sure that baby is growing well. I just had a patient who looked like the baby was doing fine on day of life 5 and was 14% below birth weight at 2 weeks. And that's way too long to not be feeding well. So it's very important for you to keep those appointments.
Okay. So that is, yeah. And I think that another thing that we see and a lot of people are doing is that they are, maybe not even showing up to the pre and postnatal appointment because they're so worried about what's going to happen if they do. And we really like to tell everybody, your providers are safe, your areas are safe. Like you said, we clean in the offices. We are making sure that everybody is doing okay. There is a question about, is it safe what happens when you go into labor in a hospital? Will I be allowed to have my partners there? Will I be allowed to have anybody else there with me? Or am I gonna have to have this baby all by myself?
So that's it's a tough question to answer across the board because every hospital, every region has their own policy. I can tell you that what I'm seeing and hearing from most hospitals is that as of right now, yes, you can have, one person in the room with you when you are in labor, but in an effort to protect other patients and to protect the staff, they are limiting it to one person. And so that, again, that's going to differ. And some hospitals are saying when mom is in active labor, that one person can come in. Some hospitals are saying that one person can be there the entire time. Again, this is a very important topic, and have a conversation with your provider and have that conversation early. Things are changing very rapidly, constantly. We're constantly getting new guidelines from the government, the governor. And so I don't know what things will look like in 2 or 3 months or even 2 weeks. But as of right now, I know that most hospitals, in an effort to protect the patients, the staff, they are limiting it to one person in the room. But, thankfully, I haven't heard of any hospitals in my area that are forcing women to deliver alone. There are some hospitals that are saying if mom is COVID positive, that she will have to be alone, but if mom is COVID negative, she can have that one person in. So it's important to speak with your provider and find out exactly what your hospital policy is right now. Genevieve, I don't know if you're hearing anything different.
Genevieve, how is that? What is that like in the UCLA?
So at our hospital, we've had a variety of things over, it's changed sometimes weekly, but what's currently happening now is that our policies are always posted on our webpage at uclahealth.org/coronavirus, I think it says, but if you just Google Corona and UCLA Health, it comes up. And patients are being universally tested. So all of our patients, when they enter, are being tested immediately. So we know right away whether or not, and UCLA is amazing. I mean, I'm not here to speak on behalf of them, but I just have to, shout out that they are some of the they are some of the best ever, because they had testing up and running early March, and I had some symptoms and I was tested really easily and very quickly, and I was negative, and it's not a fun test. It's not a fun test at all. So they are testing all of our patients, so we know right away what we're dealing with when we have it and when we're dealing with it. Partners who are positive or partners who are symptomatic are not allowed to be in the hospital because they need to be at home, convalescing and caring for themselves. But definitely we have partners in labor and delivery and on postpartum now. But we are practicing universal masking, and the expectation is that when I come into the room to service a family, that the father of the baby or the partner of the baby is wearing a mask at all times, and we're wearing a mask at all times because that would be appropriate. So the birthing parent is not required to wear a mask during labor and delivery, and unless they are COVID positive, and then they have other precautions in place to manage COVID positive patients in those situations. But what I'm seeing right now that a lot of families are really concerned about is that they would really like to have a doula. And unfortunately, doulas are not considered, healthcare workers right now. But that doesn't mean you can't hire a doula. And I do all of our childbirth education classes. And what I like to tell parents is that you can still have a doula, and you should be laboring at home. You should not be coming to the hospital when you're 1 centimeter dilated. You need to be at home, and you need to be working that baby at home.
And that's regardless of COVID or not. It's like laboring at home is the smartest thing that you can do, regardless.
And learning those comfort measures and having a doula at home, and you don't want to come to the hospital until the last possible minute. I remember my mother always tells my birth story, and back in the old days, like, you had to pay for every night you were in the hospital. So you waited until midnight to go to the hospital. You waited until 12:01 to go into the hospital so that you didn't have to pay for an extra day. And so, you would labor around the hospital, right? You would walk around the hospital and walk. Right. It's so good for you.
Right.
And so I would just say, there's a lot you can do with doulas, and you can still hire doulas and still have them and use them. And I would highly recommend that you still consider using doulas. Even if they can't come into the hospital with you, that will be of huge value to you.
And if I can piggyback off that, many doulas are offering their services, obviously, before you go to the hospital. And then once you're in the hospital, they're available for you through virtual, sessions. They can come to your home afterwards. So it's definitely, I agree with Genevieve, do not hire a doula because of the current policies, because they really are a huge benefit. And another benefit, I think if I can say this, one of the good things that's going to come about through this horrible pandemic is that I think many women are kind of finally realizing a lot of the things that those of us who work in healthcare as midwives and lactation consultants, as doulas and nurses have been saying for so long. Labor at home as long as you can until you're in active labor. Once you have your baby, I think some people have this thought of being in the hospital like it's a hotel and people are going to take care of me and pamper me. And we know that one of the best places to be is at home. In your home where you're comfortable, you can nurse your baby comfortably, where your doula can see you, your consultant can see you, lactation consultant. So many patients now are finally asking, can I go home, the next day? Is it okay? Do I have to stay in the hospital? It's like, no, if you're healthy, baby's healthy, you guys can get out of there. They'll discharge you. So I think a lot of the things that are kind of being implemented now are things that we've all kind of been preaching and kind of talking about for a long time. And people are finally realizing yes, the hospital can be a good place to deliver my baby safely. But before I get to the hospital and after I leave the hospital, there's so many resources available to really help me through this process. So I'm glad that it's finally coming to light.
Yeah, this is one of those things, I also think that we are just, you need to remind people that, that we do a lot of virtual care. So we have virtual midwives who will go with you into the hospital if you're in a hospital that says that you cannot do that. We are an international and national program. So wherever you are, you can get our help. We are not just in the state of California or in one state, we are all over. And I do want to remind everybody online right now that if you have any questions, just post them into the chat and we will go ahead and answer all of your questions. We'll try to get to everybody today. If not, visit us on our Mammothon this weekend. All of our advice and support is free. All our lactation classes, support classes, are all for free for everybody. And please join us for that.
Hey, can I give a big shout out to BabyLiveAdvice actually, because, when you do discharge early, about 24 hours after, it's usually day 3, 4, or 5 when things get tricky for most people. And so making an appointment with a lactation consultant, talking to a nurse midwife, talking to a social worker, talking to somebody on days 3, 4, and 5, having a plan in place in advance and having that appointment set up. Not all hospitals are providing outpatient services, and your pediatrician isn't going to answer the questions like, is it normal for my baby's poop to look green on day of 3? Like they're not going to always answer those questions for you. And so making an appointment, having a plan in place to have a what I call the discharge follow-up phone call is a great way that you can just get your questions answered in a timely manner.
Especially if you are discharged on a Sunday and you're completely engorged after giving birth to twins. Yeah, that would be very, very helpful.
But no doctor want to talk to you at all.
And you can't set up that breast pump and you're lost.
Oh, believe me. Yeah, when you didn't sanitize anything before you went into labor. Yeah, definitely.
We also, we have to remind ourselves, a lot of our moms are actually living in rural communities. And, going back to the hospital is not even an option.
Right.
It's about it's about 7 or 8 hours away. So, we had moms who got discharged from a hospital, but, they cannot even go back when they're in an emergency. They need a lot of help.
Yeah.
So, we do like to have, us available to them. One more question. This is a very good one. So let's say that I've been told to be discharged early, but I'm not ready to be discharged yet. What are my options in staying in the hospital in time of COVID? Am I going to be forced to leave the hospital?
Absolutely not. So the typical policy is that for vaginal deliveries, a woman has 48 hours to be in the hospital. So you never, ever should feel forced to leave before that time if you're not ready. That's very important to stress. And then for a C-section, a woman has 96 hours available to her to be in the hospital. As long as everything's stable, you have 96 hours to be there. So again, if you've had a C-section, you don't feel ready, you really do feel like you need that support. And I'll tell you a personal story. Like I said, when I had my babies, my first set of twins, I'm in the medical field, I'm a midwife, I know, I want to go home, and I had a C-section, and I'm going to go home post-op day 2, I'm going home, please, or I think, and I remember the lactation consultant coming to me and she said, I know you're a midwife, and I know that you're a nurse and you've been in this business, but this is the first time that you're a mom, and this is the first time that you're nursing, and I really feel that I want to work with you a little bit longer. And I want to help you because you're going to go home and you're going to have to feed 2 babies and you're committed to this. So I would really, really appreciate it if you stayed an extra day. And I have to tell you, I look back on that and I'm just so thankful that she kind of, served me some humble pie and said, it's okay to be the patient, and just let us just stay and let us work with you and help you. So again, I hope people don't feel like we're trying to force you to leave the hospital early if you're not ready. Your rights are 48 hours for if it was a vaginal delivery, 96 hours if it was a C-section. So again, be vocal, speak to your nurses, speak to your lactation consultant, speak with your provider when they're coming in to see you about what your needs are and what you need. Because everyone's situation is different. I mean, there's people who have servants waiting for them when they get home, and there's some people who don't even have a home to go to when they leave the hospital. And that is the one time when you're in the hospital where you have, you know, doctors, nurses, midwives, lactation consultants, psychologists, social workers. There's a lot of resources available to you. So raise your hand and speak up and say what you need during that time.
Mm-hmm.
Yeah, and to that point, you know, one of the things that we try to do at BabyLiveAdvice, which somebody's asking if we are available in all states. Yes, we are. We're available in all states and internationally. One of the things we're trying to do is exactly that, is to have all of the services available to you online, but also empower women, right, to ask the right questions,
yes,
to advocate for themselves. We give you the language that you need to self-advocate, to ask the right questions of your doctor, to tell your doctor what your birth plan is, what you want to do when you come out of the hospital, what you want to do, what your birth is going to be like, and really give you that voice that a lot of women unfortunately don't have, to really advocate for themselves. Genevieve, this one is for you. It seems like after 5 days of breastfeeding, my breast supply is gone. Should I right away jump into a bottle, or what should I do next?
Well, I would want to know a lot more, because I would want to know a lot more about what happened over the very first 5 days. So if the baby was gaining weight or was doing well and then suddenly you weren't, that would be really unusual. And I would recommend that we would do a full history to find out what's going on. Absolutely, we have to feed the baby. That's the number one rule, is feed the baby. So I would want to know if we were pumping and what makes you think that you don't make enough milk, because a lot of times the baby is doing just fine. So we would want to look at other things. Are the babies having good wet and poopy diapers? On day 5, we would expect the baby to have at least 4 to 5 wet diapers and about 4 poopy diapers that was more yellow in color. If you weren't seeing that, then I would agree with you. We probably need to give the baby a little bit of extra supplemental milk, and we would need to start pumping right away.
Okay. By the way, in general, I have to say that a lot of people struggle a lot with breastfeeding. They're tired, they're exhausted, they're emotional. It is COVID time. They have the other kids at home. All hell breaks loose on them. There's a lot of stress. So, you know, what do you tell them when they call you or ask you about it and just say, you know, I really don't think I should be breastfeeding right now because of everything that is going on? What would you say to those moms?
Well, I don't think a lot of moms who are feeling stress right now, breastfeeding actually, when breastfeeding is going well, actually has like a palliative side effect. It actually makes you feel good when you breastfeed well. So what I would say is, don't judge breastfeeding by the first 3 weeks of life. Like if you're trying to make a decision about breastfeeding, I would say wait a couple of weeks, because the benefits always outweigh the risks. The benefit of breast milk to your baby is really high. So if you're feeling stressed out right now, I would focus on what you do have control of. For example, you do have control of, if you have a breast pump, using a breast pump to give yourself a break if you need to. And it would depend a lot on what's going on with the family in particular, because there's no one right answer. I had a deaf patient this last week who wasn't making any milk, but the baby loved to breastfeed. But the baby wasn't gaining any weight. Like the baby, you know, so we had to make a different plan for that family. We had to make a plan that included bottles and it included supplementation, and we had to use a breast pump to see what was going on, and we had to let the baby breastfeed because it was the one way that the baby would calm down, and it felt good for both mom and baby. But the milk supply was really low, so we needed to make a plan that was specific for her. And that was going to be doable because she had an older child. So I don't think there's one right answer in these particular situations. We really have to have a good conversation with each of our patients to find out what the best plan is for them.
Okay, perfect. Well, we're coming out on time. So in closing, you know, I'll let you each, you know, kind of speak freely about what you think is going on right now with COVID. How do you believe that this is going to change maternity care for us here in the United States, or specifically for you as a provider? And what extra wonderful tips do you have to our moms who are listening in right now, about 400 of them?
Go ahead,
Genevieve.
Elaine.
Go ahead, Genevieve.
Oh, okay. Well, I would say with breastfeeding is that you've got to learn about breastfeeding. And so where I work, we teach a 3-part series of basics of breastfeeding, a class called Making Milk and Sustaining Breastfeeding During Separations. And we are offering that class to our patients right now for free. And if you haven't taken a breastfeeding class, I would highly recommend that you sign up and take a breastfeeding class and learn as much as you can, because knowledge is power. And when you get off to the best start in the first three days of life, then it makes the first 3 months go a little bit easier. And the other thing is learn hand expression. Learn how to use your hand to milk your breast. And I know that sounds like super crazy, but moms who take the milk, make the milk. And that's the number one thing. You got to take it to make it. If you don't take the milk out of your body, you won't make enough milk. And that is the bottom, the bottom line on milk production. So learn how to get the milk out with your hand or a breast pump in the event that the baby isn't feeding well.
Wow, thank you so much. Elaine, what about you?
So I think one of the positive things that I think is going to come out of this situation is that I really believe that we're all going to get back to basics. And I think that this, focusing on life, death, how quickly people can get sick, how quickly people can lose loved ones, I think that this is really going to cause all of us providers, patients to really get back to basics. And like I said, talked about laboring at home, maybe a little bit longer. If you're feeling good and you're feeling ready to go to the hospital, going home when you're ready, staying home and kind of blocking out people that necessarily don't need to be there. That's one of the things that I think new moms struggle with the most. Everybody wants to come in and help you. And if you want to breastfeed successfully, sometimes you really need to lock down and it's just you and your baby walking around topless and your partner helping you. So I hope that we can all kind of get back to basics and focus on just this super important and transformative time in your life. And I want to stress to people that are listening right now that are pregnant or maybe just had a baby, I know it may seem like the world around you is falling apart, but I really hope that no mom right now doesn't feel the joy and just the blessings of being pregnant or having a new baby. It's such a special time in your life. And I think as we're reflecting on Mother's Day coming up, any one of us that are mothers can look back and think about when we had our babies and what a special time it was. So I hope that, I know there's a lot of negative and scary reports in the news and it can seem daunting, but I hope that you enjoy this time and that you're able to block it out and just really take in the moment. And we at BabyLiveAdvice, we're here for you. We're available for you 7 days a week. Please reach out to us, chat with us, email us, schedule a time to talk to us. If you're scared, have questions, we're here for you and we want to help you.
Excellent.
Absolutely.
And again, I'm just going to remind everybody that this weekend, the Mamathon is all free, all access for all of our advice, support, lactation, mental health services, midwifery, all the questions answered for free. And go ahead and make your appointment. The code to use is MOM, and it's babyliveadvice.com. And thank you guys so much for joining me today.
Thank you for having us, Sigi.
Thank you.
Part of Baby Live Advice. And happy Mother's Day, happy Nurses Week for those of our nurses. And thank you so much.
Thank you. Have a blessed week, everybody. Thank you.
Goodbye.
Bye-bye.